Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Hello and welcome to Pedo Teeth Talk. I'm Joel Berg, your host, and this is the podcast where we bring you all things important to great pediatric dental practice. And today, I am thrilled and honored to have with me one of our greatest superstar practitioners, Dr. Jessica Meeske from Hastings, Nebraska, who will talk with us about how Medicaid can work well in one's office. Welcome, Dr. Meeske.
Thank you. It's nice to be here.
Thank you for being with us today. Jessica, you have done it all. You practice, you volunteer, you've been involved in organized dentistry at pretty much every level. I can't think of what you haven't done, and I don't know how you do it. But in our limited time, we want to pick your brain on something you've done exceptionally well, and that is being an advocate as a practitioner, but also for our profession related to Medicaid. So first of all, tell us a little bit about your practice. I know you have the main one in Hastings, and I believe you're in Omaha, but just tell us about your practice and a little bit about the history of it.
Sure. Well, when I came out of residency, I joined a pediatric dentist that was located in Hastings, Nebraska. So that would be in the rural part of the state. And then we also have practice locations in Grand Island, in North Platte, which are both rural locations. And then recently, last month, purchased a practice in Omaha. So we have 4 locations, and that makes it fun and yet challenging when you're trying to see a lot of patients that have Medicaid as their insurance plan.
So you're practicing full-time essentially, and the manager essentially, the CEO, so to speak, of all these offices. Is that right?
That's correct. And we have 4 doctors in these 4 sites. 5 doctors since we added our Omaha doctor.
And you sound so calm and relaxed today. Like I said, I don't know how you do it. So I want to go right into the Medicaid part. This is something on the minds of every pediatric dentist because we all want to do well and do good. So can Medicaid work? Can you do well and do good in your practice?
Absolutely, Joel. I think the main thing is you really have to have a passion for helping these kids, and you have to understand it's a process and it's a journey, and there's bumps along the way. But if you really try to become a student in understanding how the system works, how these kids are best served, you can be quite successful doing it. And you just feel really great when you're taking care of these kids who need our help.
So regarding your practice, did you choose right away? Was the practice already seeing Medicaid? And why did you continue, or why did you choose to do so in your practice?
Yes, and I'm so glad you asked me that question. When I did my residency training at University of Iowa, understanding how to work with the Medicaid program and caring for those kids was certainly a part of our training, and not just from a clinical standpoint, but from an advocacy standpoint. So I knew when I was looking for my first job opportunity, it was going to be in a practice that was committed to taking care of these kids. Having been from rural Nebraska, I was looking to go back to that area. I knew they needed pediatric dental services. And I found a wonderful man by the name of Ed Lockwood, who was the first pediatric dentist in rural Nebraska. And we got together and we talked about all the things that new potential associates talk about with practicing doctors. How do you want to do this? Do you like to use nitrous oxide? Are you going to want to do sedation? And what was so amazing about that is after we went through a lengthy dinner and he was so kind to answer all my questions, what he said, Joel, is as long as we can agree that we both are committed to taking care of this population of kids, we'll figure out the rest. And I never forgot what he said. And to this day, it still is a big part of our practice. And we just love it. And we feel like we're making a huge difference for kids out here.
So what you're describing, Jessica, is commitment. It's a commitment to that from the very start. And that's how you began. I think that's what's required. Would you say that's a requirement?
Yeah, I think it even starts with it's a philosophy. It's a passion. It's about
Mm-hmm.
how you look at kids and what our role is to help kids. And then from there, if you're committed, as you said, to trying to make it work, then it's just about creating the systems and working with the Medicaid programs or the contractors to figure out how are we going to make this work.
So regarding the systems, and when one talks about Medicaid, and particularly those who've chosen not to accept Medicaid, patients who are insured by Medicaid, what are some of the challenges? I could name some, but I'd like to hear you talk about sort of the main challenges that you've encountered, or maybe even the misconceptions, because some challenges may not actually be there, or you've learned to mitigate them, let's say.
That's correct. So as we know, a lot of kids that are covered by Medicaid have many issues within their family dynamics that are typical for families that are facing poverty. So it may be issues of a lack of transportation, childcare issues, a parent just even knowing when is the right time to schedule their child for a dental visit. And so the most important thing is that first encounter with whomever is answering your phone, it's friendly, it's welcoming. We're so glad you called. We would love to see your 1-year-old. And once we get them in the door, then the process starts for what will be the next 18 years to hopefully create a child who grows up to have a healthy dentition and a beautiful smile.
But have there been some, given those, the way you've responded, sounds like your entire staff is what you're talking about, is engaged in this, and the passion isn't only from you, which obviously it is. It's from everyone. It's sort of the core belief of the practice. But certainly there have been some challenges. For example, if I were to throw out higher no-show rates, first of all, is that true? I just use that as an example. Is it true? And if so, what have you done to deal with it?
It depends on the research. There's been research studies that show that the no-show rates are higher, and there has been other pieces of research that show it's really not that much different. And so it's really important that practices implement policies. And so, for example, we would allow patients to have a no-show, but then we would make every attempt to try to call that parent and really try to get to the root of what is it that's causing the family to break the appointment and not be there. And certainly we do text messaging through an automated system that will help provide patient reminders, allow parents to confirm appointments through their cell phones. But I really find the best way to counter no-shows, and it doesn't matter if you have a kiddo that's on Medicaid or a kid that's privately insured, is to really sit down and visit with that parent why it's important to keep that appointment, how much you care about that child and that child's teeth. And so that's one of the things we deal with all the time, is working through the no-shows.
So because of that effort, that proactive effort that you and your staff are making, you would now say then that the no-show issue is not really an issue?
It really isn't an issue for us, and we certainly have just as many non-Medicaid families that choose not to show that we have to provide the same sort of parent education. But some of the things that we do besides trying to get the family there in the first place and visiting with them is we make sure that we have other patients that we can move into those spots, or perhaps a child's come in for a new patient exam, now needs work done. We won't hesitate to offer a parent, would you just like to stay? We can go ahead and get the sealants done. The previous child was not able to come for their appointment. So let's work together to make the best use of our time. And what I've really figured out is I am done getting upset and disappointed. And I have moved a long time ago from that to what is it we need to do to make this work for us and for the kids.
It's your attitude. That's fantastic. And I think when I hear you discuss the conversation that you have, and in particular in this reference to no-shows and how to prevent them, it really, in a sense, is a conversation about health literacy and about the medical necessity of the visits to your office. And so really you're kind of going upstream and talking about health literacy, Would you say that's true? And you're therefore making it more important to them, and therefore they take ownership of it.
That's exactly what happens. And it's not only the doctors that are taking the time to do it, even more so, we educate our staff and make sure that they understand, what is it that is causing this parent to respond in this way or not value their child's oral health. And once you can get your staff to see that it's our job to try to help them with that, then really everything forward is able to have the chance to be much more smoother. So we spend quite a bit of time doing continuing education with our staff, not only on how do you work with families who may live in poverty, but how do you work with Medicaid programs? How do we make sure we're doing the right thing on behalf of the kids? And we have to do it in the most efficient manner as possible. So we're mindful of the money that we're spending, that taxpayers give us through the Medicaid programs to help kids.
So speaking of those programs, as you know, and I think our audience knows, that Medicaid programs it's a federal program, but it's implemented by states, and therefore we have varying programs depending on the state. And so I don't want to get too much into the nitty gritty of the specifics of Nebraska's program, but I think you are an expert not only in Nebraska, but on national issues. So I guess I'll just put the question like this: because Medicaid can't cover everything, with limited resources, there's on one hand the level of payment relative to the usual and customary rate, but there's also what is covered, what is allowed at all. So do you feel conflicted when you're trying to balance what's best for the child, what you know is best for the child, for that patient, and what the program is willing to cover?
Absolutely. There are times when, as pediatric dentists, I think we feel conflicted about wanting to do the very best we know how to do for that child and their condition, and then yet feeling like we're limited because our Medicaid programs say we're only going to cover this. And I think there's two things that pediatric dentists and their teams can do to look at this issue. One is we have to be mindful that, just as you said, there's a limited pot of resources. And just like there is a limited amount of money for K through 12 education, part of our job is to figure out how do we take those resources and invest them in the best and most efficient ways across the population, whether that be the population of children in your practice or the kids that live in your state. I think the other thing that's so important for dentists to recognize is you can't feel like a victim of the rules of Medicaid and the circumstances. If there's something that you think needs to be changed and will make the program better and better serve these kids and special needs adults, you need to be an advocate for those kids and for your patients. And that is so easy to do in so many different ways, whether it's through your state chapter of your Pediatric Dental Society, your state dental association, or you can work directly with your state Medicaid and contractors to have a real say in what's going on within the programs.
Yeah, I love that. I think, what you're saying, Jessica, is that ideally if everybody were an advocate at some level, then the program would evolve in response to that advocacy to balance the total funding with what's the best thing for all children. And it's sort of an evolution that is going on continually, not just for that patient, but for the population as a whole. So what you're saying, I think, is that everybody contributes to that process of improving the program through advocacy. Is that a fair way of characterizing it?
It's absolutely that. And part of that advocacy is building relationships with the people that are making the decisions. So whether that be the people that are running your Medicaid program or your state legislators because you need a larger appropriation for Medicaid, when you work to build those relationships on the back end, making those asks for things like silver diamine fluoride or a zirconia crown or whatever it is that you're trying to do to make the program better, those things will happen quicker if you look at it as this is a long-term haul. You will not get everything you ask for, but through providing good evidence and research and continuing to ask the question and show them the benefit of the service and how it's going to save money, we're seeing changes almost every month in our Medicaid program here because we've got a good relationship with our contractor.
What do you do in a situation where there's a service that you believe is necessary or something the parent wants that you agree is necessary and it's not covered at all? How do you deal with that specifically?
Yeah, those are the tough conversations that you learn to have with parents. And we've gotten really good at those in our office. And a really good example of this is orthodontic care. And so we know many states have really minimized the amount of Medicaid dollars that they're going to spend on orthodontic care. And as a pediatric dentist, there are many things you can do to intervene with these malocclusion problems earlier that's going to make things better for this child, but Medicaid is likely not to cover. So sitting down and talking with parents, showing them study models, showing them photos to say, your child would really benefit from having this treatment, but it's something that's not going to be in a covered service by their insurance plan. If this is something you really want your child to have, then let's figure out from there, how can we make it affordable? And Joel, what we're finding out is more families than not are putting down money for dental services for their children when Medicaid isn't covering that. Now, that's not going to work for your kids that are in foster care or are really in dire situations. But we have to remember, when we're talking about a population that's covered by Medicaid, there are thousands of kids from families that do have the means to do this, and they're willing to sacrifice. And they'll come in with jars of cash because you have told them how important it is, and they have saved money to make this happen for their child. And it is such a beautiful, exciting thing when that happens.
Again, it's a conversation about health literacy and self-efficacy on the part of the parent on behalf of the child, and all these things. So all these conversations you're having have all these multiple benefits across the board of getting the families to understand the importance of the role they play in improving the health of their child. And you're the catalyst for that. You're doing the great job there. That's fantastic. I want to shift a little bit in our last portion here to your staff again. And you've talked a lot about, and I think it's clear in every well-functioning dental office that a patient and family will spend far more time with the staff collectively, certainly, than with the doctor. So how do you keep the staff motivated? They're the ones dealing with the challenges, which you make sound so simple because you have the processes, but it's not as simple as perhaps it sounds. How do you motivate them to continue to serve this population and to minimize frustration or discouragement? How do you deal with that?
That's a great question. One of the things that we do is every morning when we have our morning huddles and we talk about the kids and the families that we're going to be working with that day, we share success stories. What happened yesterday with a child that just made you feel really good about the job that you do. And many times it's the doctors and the managers and the clinical coordinators who are the leaders that are pointing out individual team members and saying, you know what, Whitney, you did such a beautiful job helping that child yesterday get through those extractions. They've been in foster care, they've been moved from home to home, and you took the extra time to really make sure that they had a comfortable and successful appointment. And the staff's faces just light up because they know they're making a difference in these kids' lives. I think the other thing is talking about continuing education. We read books as a team that talk about kids in poverty. We read Ruby Payne, who's an expert on poverty. And we do lots of things like webinars and tools that the AAPD and the ADA make available that help us to understand how do we make sure we're getting better and better at this every day, because it is a challenge. There's no question.
Yeah, that's fantastic. It's inspiring to hear about your leadership role, and that's what I think you're describing here. What I hear is that you're the leader, you're the CEO, and in this way, you're the leader of the practice who's motivating your team to continue their exceptionally important role in making this happen so well. So I'm going to shift from just a moment on something that everybody thinks about, practitioner providers do, they don't want to talk about, and that's the dreaded audit. Medicaid has audits to avoid fraud and overuse, et cetera, and they're not perfect systems. And my understanding is you've experienced this yourself, and maybe just for a moment, you could share that experience and what advice do you have having gone through that?
Sure. And having been in practice for 19 years and seeing a lot of kids that have Medicaid, one of the things that listeners need to remember is the more children that you see on Medicaid, you are more open to the government making sure that this money is being spent correctly. And so you have to not look at it as a bad thing. It's not a fun thing. It's not a convenient thing. And boy, Joel, when it's not done correctly and fairly, you need to stand up and say something. So a lot of times these audit practices have been reversed. New policies have been put in place. But if we don't have dentists that are willing to stand up and say, wait a minute, I don't think this audit was done in a fair way. Most of the time, it's really more of a nuisance. It's a spot check. It's send in 5 cases. We just need some justification that these kids had the treatment that they did. And we really shouldn't be surprised by audits. School districts are audited. Universities are audited. Taxpayers do have a right to know that those dollars are being accounted for.
Right. Commercial insurance audits, too. They all do.
Absolutely.
Yeah. I think that's great advice. The perspective, again, it's your perspective on it. And you had it was a challenge, but I recall how well you did in terms of responding in terms of the system and actually changing a system that benefited others because of your experience. You rose to that occasion, which is fantastic.
I was really proud of our dentists in Nebraska. About 4 years ago, we went through what was called RAC audits, and our dentists really rallied together. And instead of getting mad and quitting seeing kids on Medicaid, we said, what is it that we can do to make sure that these audits going forward are done in the right way? Because really the purpose of the audit is you want to catch the guys that are really doing bad things, but there's also going to be a group of dentists that are trying to do the right things, but maybe some things just need to be tweaked, like their coding or their billing. And instead of making that to be a major deal, working to educate dentists to say, hey, can we have you change this to that going forward?
Right.
That's going to go a long way to make sure it's win-win for everybody.
So it's a process improvement activity is what it is.
It really is.
Medicine quality is about process improvement. I think one of my favorite Albert Einstein quotes is continuous improvement is better than excellence never achieved or perfection never achieved.
That's a great way to put it.
I think our systems have to be continually improved, and it's up to everybody to help that. And that's what the audits should be about. I think that's the change that you facilitated in your instance of making the system better for everyone. So the final thought I want to just touch on at the end here today is you started today, Dr. Meeske, talking about your initial experience and that dinner you had with starting your practice in rural Nebraska, and how it was a passion that was needed to be shared to treat patients on Medicaid. Today, for our young dentists listening to this podcast, they're faced with higher debts. They're trying to be successful. They want to do well and do good. But the challenge is even greater, I would say. The barriers are greater, given some of the changes in systems. So what advice do you have for them listening today so that they could have the passion throughout their career and continue to do this great thing that you've done in their careers? Please tell us your thoughts on that.
That's such an important question. And I do understand when dentists are coming out with these higher debt loads than I may have had 20 years ago. And certainly we hire these young dentists as associates. I think there's several things that I would recommend to new dentists starting out. That is, number one, keep an open mind. Remember why you went into the specialty of pediatric dentistry. Secondly, make sure you hire the right people that share your vision, that want to help kids, that may be going through difficult times. And then make sure you provide the tools so they can do their job, whether it's a facility, whether it's technology, whether it's spending time talking about the rules of your Medicaid program. And then I think the last thing I would point to is seek a mentor. Find a pediatric dentist who has done this well. Take them to dinner. Let them take you to dinner by all means, and really ask them, how do you make this work in your practice? They are a wealth of information. I have at least 5 to 6 pediatric dentists nationally that I touch base with probably every month. And that's after being in practice for 20 years. And you have to say, I'm struggling with this. Tell me how you made this Medicaid issue work in your practice. And I'll leave it at that.
So I think your advocacy work supersedes all, is getting others to understand what you've done to continue to be successful. And I've learned a lot today. I have to thank you, Dr. Meeske. So thank you so much for being with us today and talking about Medicaid. I'm Dr. Joel Berg with Pedo Teeth Talk, your host, and we're thrilled to have brought to you today this conversation with Dr. Meeske, and stay tuned for future editions of Pedo Teeth Talk, where we bring you the issues important to you in your practice of pediatric dentistry. Thank you very much.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.